them is supposed to wear these, right?
Yes.
Mm-hmm.
You adjust however you feel like you need to adjust. Alrighty, so I'm gonna go ahead and start off here. Okay.
Hello, everyone, and welcome back to another episode of Health Yes here at Cameron County Public Health, where we talk about all things public health and more. I'll be your host today, Javier C, and
Enrique.
And today we are joined by Michelle Hairston, stroke coordinator, joining us from the Valley Regional Medical Center in Brownsville. Welcome to the show.
Thank you. I'm happy to be here.
Awesome.
So my name is Michelle Hairston. I am the stroke coordinator for Valley Regional Medical Center in Brownsville. I've recently come to their facility, and I was a stroke coordinator prior, last 2.5 years at Valley Baptist. And I moved over to Valley Regional and been doing this a while. So stroke is a really big part of what I do. I'm very passionate about it. The biggest thing is community education. And we're here to talk about AFib, which AFib is the leading cause of stroke. Most of the time, people who have AFib, they're more likely to have a stroke than anything else.
Gotcha. We're calling it AFib. What is the actual...
So atrial fibrillation, it's normally your heart contracts and normally, right? Mm-hmm. So basically what happens with AFib is that your heart is sitting there trying to pump and it can't. So it sits there and quivers until finally the heart pumps. Mm-hmm. So what happens is when you have blood that pools, it starts clotting. And these clots will sit in your heart, or they can be pumped out and head all over your body. And more than likely, it's going to head to your brain and cause a stroke. So it's very, very important to understand what atrial fibrillation is, how we treat it, and what we can do to prevent the complications from it.
Gotcha. Now, in talking about understanding AFib, what are some of the things that we need to look out for, the symptoms, etc.?
So a lot of times AFib has no signs and symptoms.
Mm-hmm.
You don't even realize you have it until you've had a stroke. And that's when you come into the hospital, we hook you up to an EKG machine, and we're seeing your heart, and you're like, oh my gosh, you're an AFib. This is what's going on, and we basically diagnose it like that. However, there are some signs and symptoms such as racing heart, fluttering, palpitations, shortness of breath, fatigue, lightheadedness. And usually it's if you feel like your heart's skipping a beat, or it's racing really, really hard, and you're like, oh my God, what's going on? Is it the coffee I drank? Is it that Red Bull I had earlier today? But if you're just sitting at home, you haven't had your coffee, you haven't had any of that, and your heart feel like it's just continuously racing, you're getting really dizzy when you stand up, those are signs and symptoms of atrial fibrillation. Gotcha.
We've had a guest on here before who talked to us about heart palpitations and how and I guess the question here is like is it similar to someone feeling a heart palpitation? Like, is there some sort of confusion? Like, what's the difference between just like a heart palpitation versus something like this?
So atrial fibrillation is an arrhythm of the heart, right? It's in there fluttering until it actually pumps. And that's where a palpitation could be where your heart's skipping a beat. There's multiple rhythms of the heart that can happen, right? And that's more palpitations, usually just skipping that beat, right? I don't even know how to describe that.
I think something you mentioned earlier is actually really important because you really don't know what's going on. And you really don't even know the name for it because I remember specifically when it happened to me. It actually happened when I woke up. So I woke up and I just felt off and I couldn't explain it because I figured, sometimes you'll wake up from a bad dream and your heart's racing or something. So I thought maybe it was the alarm, how it shocks you awake sometimes. And so I took a shower and I was trying to convince myself that something, I was aware that something was off, but I wasn't aware of what was going on. And it wasn't until like I actually put my fingers on my wrist and I started taking my pulse and I realized that the rhythm was off. It was like Morse code. It was beep beep dash beep beep dot beep. And I thought maybe it'll go away. I drank some water. I tried calming down, and it wasn't going away. So then obviously I got alarmed, and I decided to tell my wife. And I was like, hey, I'm feeling really weird. I don't know what's going on. And it's like, well, go to the hospital. So of course I went to the hospital. They hooked me up to the EKG. They were trying to figure out, obviously, they were, was it a heart attack? Is it this? Is it that? Is it this? And then finally, like, my family physician came in and he explained to me, he's like, you're going through AFib. And I'm like, so what causes it? And like, we don't know. Like at the time, I looks like some of the literature here showing like apparently now there's more information on it. But when it happened to me, there was nothing. They couldn't explain this. It's just people just get it sometimes. So, I mean, obviously at the time was one of the most stressful times in my life. So I think maybe that had something to do with it. But I think the important thing is that we don't discount feeling different if something feels off. Because I think that the biggest problem, especially here, is that a lot of people will write it off like, I'll just drink a Coke or I'll just drink something. And
You would be surprised at how many times people will come in with signs and symptoms of a heart attack, stroke, various other things. And they've had it going on a day, 2 days, a week. And they're like, it's going to be okay. I'm going to find, let me drink the Coke. Let me just rest. Let me take a nap. Not realizing there is actually something seriously going wrong and seeking the care. And that's the biggest problem. And it's so prevalent here in the Rio Grande Valley that people will ignore symptoms. One, they don't have insurance, right? And it's a big concern because they don't want that big hospital bill. But no hospital will turn you away. If you go to the emergency room, they will treat you. Yes, you'll eventually get a bill, but hospitals will work with you.
Right.
You know, your health is important. They always say, you know, I would die for my children, right? But would you live for them? Would you live for your grandchildren? You know, your family. So seeking the care if there's something wrong when you're feeling different is vital. It could save your life.
Right.
And you wouldn't understand how many times we've had stroke patients come in and bluntly ignored signs and symptoms. And just their life's devastated now because you can't go back from that, right? It's stroke is one of the number of disabilities in the world. And we could have prevented this because you didn't seek the treatment or the care prior to this. And really understanding what was going on and not seeking the care. And that's the biggest problem. But that's why I'm here today.
Gotcha.
The community education, understanding signs and symptoms of medical. It's what are we doing in this podcast, right? This is what we're doing. And really educating our community and seeing a difference in people seeking the care and really getting themselves healthy.
I think the number one thing, especially afterwards, because I went ahead and got the treatment. I went ahead and got the, I forget what it's called, when they go in with a laser and burn the inside of your heart.
Oh, you had an AV ablation?
Yeah.
Which is a really weird, cool thing they do.
Yeah, it was really cool. I mean, I didn't appreciate, you know, the stages I had to go through. I had to go through Austin the day after Christmas and find an Airbnb, and both my kids were sick, and it was a huge obstacle. But obviously, at that point, I had gone to the hospital so many times that my my copay was up. So I was like, this is the only chance I'll have to get this surgery. Can you do it? And then the doctor said, we'll do it for you. It was a lot. But like I said, luckily I had the insurance help out. But ever since then, I've become acutely aware of when my heart is not beating right. Because in a day-to-day, it's like breathing. You don't even think about it. You just do it. Your heart, it's beating. You don't think about it. But now it's like every time it's sped up,
You're worried.
sometimes
you think something's gonna happen, right?
I can't tell you how many times a day I'll feel it skip a beat, and I like, and then I'm like burp, and I'm like, oh, it's just gas, because I ended up finding out the heart. You know, the surgeons told me, like, well, they're all related. Yeah, so if you have a lot of gas, you might skip a beat. So I'm saying, if you feel something off, if you're aware that, hey, this doesn't feel right, like if you are aware of your own heartbeat, then you should take note of it, and you should definitely see someone about it, and you should bring it to someone's attention that something is off. If all it is gas, hopefully, or something else, or indigestion or something, obviously that's a lot better than AFib, because it was one of those things that I wasn't aware of until I had it. And then I started seeing the commercials on TV for the blood thinners and all the... If you watch the news, that's all it is. It's those blood thinners and this and that and this and that. And it's something that it's kind of hard to relate to because people don't know this term. So I think that's the good thing is to give it a name, give it a description, and make people aware of it. Everybody knows what a stroke is. Everybody knows what a heart attack is. But obviously AFib, it's a little more foreign. It's a little...
So now, we've done so much education about the heart attacks, about the strokes. Now we're getting into what causes these symptoms, right? And educating our community about all these signs and symptoms, all the prevention we have to do for this, right? It's not just if you eat right, eat healthy, you're going to be fine. But sometimes it's genetic. Like hypertension can run in the family, and it could have nothing to do with what we eat, and it could have nothing to do with how much we try to be healthy, exercise. Atherosclerosis is hereditary. How many times have you heard somebody like, my father had a heart attack when he was 41. Right. I'm 40 now, I'm scared. Because it's genetic. I mean, if you don't take care of yourself, this could happen. And AFib is one of the prevalence of that. And like you said, there's no known cause of it. It could be electrical issue in your heart that's not quite functioning right. Which you talk about, you got an ablation, which is, so what happens is our brain sends a signal to our heart to pump, right? Along the way, that signal gets distracted or doesn't quite get there enough. So our heart's waiting for that signal to say, I got to pump. So it's in there quivering. We have 4 chambers in our heart. We have 2 atriums and 2 ventricles, right? And so what happens is the signal comes from the top of your heart, says, okay, pump, right? So it pumps from one chamber to another and sends it out. Well, there's an issue there. So your heart will sit there and quiver until finally it pumps, right? And that's what AFib is. Right. Very, very simple.
So that quivering also registers as a rapid heartbeat, right? Because I remember my heartbeat was like 173 beats per second or something. Per minute. It was terrifying. I was like getting the readings. I was like, oh my God, what's going on?
Right. And then here's the thing. 60% of the time, people don't understand what's going on. They haven't been diagnosed with AFib until something serious happens. And a lot of times it's a stroke. Right. So it's really, like you said, if you're having these signs and symptoms, seek treatment, because it could be nothing. Like if you're having a heart attack, you feel that burning sensation in your chest and you go, it's just really bad heartburn. At least you got checked out. You know what it is, treat it. So the next time when something really does happen, you know what to do and seek treatment.
And even then, I think like my family physician was aware enough to recognize the signs, where if I had just gone to him, he probably would have been able to say, well, I think it's this, you should go this. So it's not necessarily a thing where like, I think you have to go to the emergency room necessarily, but like I said, you have to make someone aware, because obviously as soon as you have AFib, that's when they start the blood thinners again to break up the blood clots, which is the whole reason it happens is of the clots that give you the stroke. So I think even then, I think the aspirin helps, but obviously they give you something stronger as it.
So using aspirin is not enough for AFib, unfortunately. People are like, I'll just take my aspirin, I'll take my Plavix, which is like aspirin. It's an antiplatelet. It'll help. Not necessarily.
Exactly.
That blood pools in your heart, and like I said, when that blood pools, it clots, and then the clot sits there until eventually it gets pumped out. And you need a stronger anticoagulation for that, and that's where the warfarin comes in. You've seen the, Eliquis and Xarelto, all those commercials for that. And there's new medications. Now, here's the other part of it. Once you get the diagnosis, you got to take the medication. The medications are really expensive. Right. Like, I believe Eliquis is like $1,200 a month or something like that. And I mean, we have resources in the hospital that you get coupons for this. And warfarin is one of the top medications people take because it's so cheap. This was back in the 1950s we discovered warfarin and what it did, and we started doing that. However, you have to keep track of your labs for that, and you're constantly making changes until you get the right dose for that. And even then, they still have to change. Sometimes people can't take the Eliquis for whatever reason. They can't take the anticoagulation because they have such a high risk of bleeding already, and that's where other forms of treatment come in. Right. And those are very, very new. Like, they're still studying them right now and figuring out what we can do for these people that have the AFib, that can't take an anticoagulation, how we can do to prevent that. So.
Yeah, it's kind of scary because I remember specifically them telling me, whatever you do, don't shave, don't cut yourself, don't anything. While I was on the blood thinners after the surgery, I was like, okay. And I was terrified of anything. And they were telling me all these stories about someone that accidentally cut themselves and they couldn't stop the bleeding because obviously they're on all these blood thinners. So it was a stressful time.
My dad had AFib, right? And he was on a lot of anticoagulation, and he lived with me part of the year. He was like a pseudo winter Texan. He lived up north, and he just got so lucky with me being a nurse because I don't know how many times he would hit something and he would start bleeding and he would not stop.
Yeah.
And here I'd go bandage him up, and I would be checking it every few, like, oh, it's crazy and then people start getting scared, like I'm gonna bleed to death. Oh my gosh, and then here's the other thing of that. You can actually have internal bleeding that you know nothing about. And that's when we start realizing, oh my gosh, there's all these complications with it. But it's like finding the right path to be healthy, right? What works for you? And everybody is different. Sometimes it's trial and error. And it can be scary sometimes because people will start bleeding out of orifices and they're like, oh my God, what's going on? And then they go to the doctor, they have to have all these tests done. It's scary. It really is scary.
I can imagine.
Yeah. So and that's where, nurses come in and they really take care of these patients. Doctors come in, they tell them what's going on, how we're going to treat this, try to make you better. So, and it's wonderful when we finally get the right treatment for somebody and they go on living their life and they just do very well.
Gotcha. Well, it seems like, education is very much a very vital part about AFib. I mean, for me, I don't really know little to nothing about AFib, and it's one of the reasons why I'm glad we have Enrique here and your own personal experiences as well. One of the things that we were going to talk, that I was going to ask about is, monitoring and all that, but.
Once you've experienced it, you'll never forget it, and you'll become acutely aware of absolutely every last heartbeat you have, and you'll start monitoring it, which is good because you start doing things like I said. I mean, again, we don't know what causes it, but I'm sure there's things that can be done to prevent it. Obviously,
and diagnosis is another really key factor to this. So, a lot of times people have strokes. And 25% of the time, they don't know the known cause of the stroke. They're called cryptogenic strokes, right? So usually what this happens is when they come in, they're not showing AFib on the EKG machine. They're not seeing any anticoagulation issues. They're not seeing your lipids, which is what causes the buildup of the fat in your arteries. Those numbers are super low. So they're trying to figure out what causes stroke to prevent another one, right? So a lot of times they're believing that these strokes that have known causes, people are having AFib, runs of AFib, an arrhythmia of the heart. But when they go to the hospital, they're not showing any signs and symptoms of that. So what the doctors will do is they put in a loop recorder. So what that does is it's kind of like, did you have one?
Yes, I did. Yes, I did. And I got some stories. I don't know, they're PG-13, but
So it's a little device that they put, it almost looks like it's a pacemaker. A lot of people know what pacemakers are. So they put it under the skin and it monitors your heart. And you have it for an extended period of time. And what that is they're trying to catch that AFib. Like, is that what's going on? So we can diagnose it, treat it, and prevent another stroke.
Gotcha.
Right? So that's where the correlation comes in with AFib and stroke. And it's crazy. So people with AFib are 5 times more likely to have a stroke than anything else. The other number one cause of stroke is hypertension, right? But AFib is so prevalent, and more people are coming up with AFib, and that's where the studies are coming in to try to figure out what's going on, what's causing this AFib, and really seeking the treatment for it.
You were talking about hypertension, and you mentioned earlier how it's something that runs in your family. And yeah, that's always been something that's run in my family is hypertension. And I was luckily diagnosed with it pretty early on, but again, that was at that really stressful time in my life.
And hypertension has no signs and symptoms either until all of a sudden you're going down for the count because you're having a stroke. You come in, your blood pressure is 250 over 125, which I have seen. Okay, that's crazy. It's like your heart's getting ready to explode. So it's connecting the dots, figuring out what's going on, seeking the care, and getting the treatments for it.
I think the thing is, the most important thing is just to stay calm. I mean, obviously it's a little hard, but it's really hard to be rational when something like this is going on. But a process of elimination, and again, that's why I think it's important to talk to a professional, because they'll be able to recognize it's not this, it's not that, it's this, and they'll take it from there. So I think that's the most important part. Like you said, if you're feeling the effects of high blood pressure, you know, your head's hurting for no reason, or your heart's racing and you can't figure out why. And even then, it could be as simple as like really just narrowing down the things going on in your life. I had an episode recently where my blood pressure was starting to get really high. And I went to go to see my doctor, and I explained to him, I'm like, I don't know if I should adjust my medications. And he goes, well, what's going on in your life? Well, actually.
Right? It's that stressor in your life. You're like, what's going on? Well.
Okay, well, then you need to calm down. And it's like, it's sometimes, like, again, you panic, and it's really hard not to. And the panic makes it worse.
Yeah, it does.
Because now you're overthinking everything. And, or I guess the worst than that would be you ignore everything. You're like, nah, I'll be fine. Like,
there's no medium. There's no happy medium. It's like you're super stressed about absolutely everything, which can lead to multiple health issues, right?
Yeah,
like
it's your heart. It's like a very vital. It's the most vital part of your system. The moment you any sort of irregularity happens with your heart, people are going to panic. They're going to freak out, especially if they don't know. If they don't know their bodies well, or they haven't been educated as to the differences between, you know, stroke, AFib, or just hypertension, etc. You know, learn your body, figure out what are the you know, the risks and the little signs to look out for, to know the differences between these things. So now, the question here: what are some of the treatments and ways to manage AFib?
So. Management, treatment. So when you come in, you get diagnosed with AFib. So a lot of times you get put on an anticoagulation, which helps thin out the blood enough that it prevents the clots from forming, which is like first line of treatment, right? Well, if that's still not working and you're still having issues, for example, you have AFib and you end up having a stroke, well, that the anticoagulation is not helping you. You can have the AV ablation, which is there's a node in your heart that sends the signal to pump, and the signal's not getting right. The signal's wrong. It's something's happening with that. So you can have that. Another thing is you can have a pacemaker put in to help. It sends the electrical current to your heart to pump and keep pumping. There's a device they were talking about. I was just reading about it, and the device helps. It's for people who can have anticoagulation. Device helps with that.
Now, how has treating, diagnosing, and monitoring AFib differed now as opposed to years ago? Like, is there a difference between now and back then?
In the last, I'd say, 10 years, we've had the more anticoagulations come out. The Eliquis, the Xarelto versus the warfarin. The warfarin was the key treatment, right? Unfortunately, you have to monitor your labs for, it's called the international rate of bleeding. It's called an INR. And what they do is they do this test 3-4 times a week when you're on Coumadin to get within a certain range that's considered therapeutic level. It is very task forming because you have to run these tests, and you can do it at home, but you have to run the test, wait for the results, call your doctors like, hey, my level's this today, which usually therapeutic rate is between 2 and 3, and they're like, it's 5.8 today, which is super high, meaning that if you really get a nick somewhere, you're really gonna bleed.
Gotcha.
So then they have to readjust the dose, and then instead of 3-4 times a week, you're checking this, you're doing it every day to make sure that. And that's what we do in the hospital too, right? And now with these new medications, we don't have to run those tests.
Gotcha.
So those anticoagulations, they target, I believe it's the FA factor of the blood, and they specifically target that to thin out the blood. And you don't have to monitor anything, you just keep taking it. However, since they're new drugs, you have to pay for all those studies they did years ago on this. So that's why they're so expensive.
Gotcha.
I specifically remember when it happened to me, it was about 12 years ago, and I think Xarelto had just come out.
Yeah.
And the doctor told me, well, I can put you on Wellbutrin, or...
Yeah, well, no,
not Wellbutrin, the warfarin.
Warfarin, yeah.
Yeah. getting my drugs mixed up. And
There are so many drugs in this world. Let me tell you.
you could literally just make something up. Oh, spinatorin. Oh yeah, sure, spinatorin.
Yeah, that's the one.
Yeah, that's it. But he explained to me that you would have to go get monitored constantly. You would have to keep tabs of your blood if it was too thin, if you were on that one. So he gave me the Xarelto because it was new, and he's like, just go to my office. I got a bunch of samples. So like, luckily, the test period that I had, that I was also wearing that little monitor thing after the surgery, just to keep tabs. But something that I don't think we've mentioned is that AFib is weird because it'll go on for a certain amount of time and then just stop. It's an episode, and there's no telling when it's going to start or stop. And I remember one time I had an episode, and I went to the heart clinic, and they were monitoring me, and they were just saying, lay on the bed. And then all of a sudden I was like, it just stopped. And they checked me. I'm like, yep, it stopped. It's like, so that's why you have to be aware that it's happening. Take notes, talk to a doctor, tell them I think I might be having AFib, and then maybe they'll do the monitor thing. But it's one of those things that people, it's not like it starts and it doesn't go away. It does just mysteriously just pop, and it turns off, and then you're like, what was that? And you can like literally just write it off. But just because it went away.
Because I had that Red Bull earlier today. That's probably why my heart's beating.
Yeah, exactly. Yeah.
Those darn Red Bulls. Dude,
I don't think
there's staples in the hospital, and I walk by and I'm like, oh my God, you're going to cause yourself to have a cardiac arrhythmia.
I mean, it keeps the hospitals busy, but
job security.
I honestly,
job security.
I mean, I think it's a young man's game or something, but I've seen people drinking Red Bulls, and I'm like, how do you do that? And then they chase it with coffee or something else. I'm like,
not that crazy.
Are you sure you're not a nurse? Because you just described what pretty much 95% of nurses do, right? Because, I mean, we work 12-hour shifts, and a lot of times they're not just 12 hours. They're 13, 14 hours. So we wake up at the butt crack of dawn at 5 o'clock to get our stuff ready, and we head to the hospital. We got to be there by 6:45, take report. How many times have you slamming a Red Bull because
you just got to get through it?
You got to get through it.
It's not just a calm, easygoing 14 hours. I'm sure it's running up and down. It's
depending
hectic.
on which floor you work in, right?
I've had stories from so many friends of mine that work in the medical field, nurses, etc., that have told me.
Nurses have the best stories about absolutely everything.
I had a friend who was telling me about how, like, you know, none of the new girls wanted to. There was a patient that they had to like hold down for something, that something was happening, but none of them were like getting up to do it. And she was just like, you know, she's a big girl, this, you know, whatever. So, and strong too. So she was like, we need you to come down. She's like, okay, another one, let's go.
Right, crack some knuckles in.
Let's go, crack some knuckles, crack a Red Bull, and let's go get it done.
Sounds like a psych nurse. Was she in a psych facility?
I don't know. I honestly don't know.
Can't help but think that, like, if Popeye were written today, if he wouldn't just chug a Red Bull instead of the spinach, like how times have changed. We used to give kids good messaging. Yeah, have some spinach. It's good for you. Now it's like, just drink a Red Bull.
Well, and they have 1.5 million different flavors, right? And 1.5 million different brands, right? And they're marketing, they're healthy, they're this. I'm like, dude, like, no. Like, no matter how healthy you market this, they are not healthy for your heart.
It's not. It'll kill you eventually. You know?
Every time.
I made the mistake of having green tea once, and I was like, why am I flying? I'm like, I didn't realize green tea had, I thought, oh, this is healthy. Yes, I see, you know, the commercials and the soft music, and yes, I'm sipping on green. I was flying. I was like, you know, obviously I've cut my caffeine a lot since the AFib, obviously, but you don't know what's happening. You don't know what's happening. Yeah.
So, I mean, this was when I was still in college, and they came out with Volt. Do you remember that drink? It was like a more caffeinated Mountain Dew, right? Yeah. And I was like, let me try that. I remember driving, and my heart was pounding so hard. It was like fluttering, like I was flying. The perfect description. Like, you felt like you're flying. I was sitting at a light, and I was just like, oh my God, oh my God, oh my God. And I was like, never again. Because of that experience, I have never had an energy drink. Like, I can't tolerate it. Like, I cannot do it. And I don't know how these nurses will slam 3-4 in a shift, or people in general.
Like I can't just kick back one. Like, you know, these guys see me with a Monster or a Red Bull, but like I don't just chug that thing. I'll have one and it'll last me 2 days, because I sip on those things.
So it's
I
not
can't
too bad.
It's not too bad, but it's still bad.
You know, and it's like the same thing with coffee. How many
Right.
times do people drink 5-6 cups of coffee?
I used to do coffee bad. I used to be on coffee every day nonstop. I don't
And
do
with
that
the trend with Starbucks and like what are like every corner now there's a specialty coffee
yeah.
place.
No, I was always going like, what's the coffee I can get on my hands on right now that has the most caffeine in it to get me through my day?
You know, actually, that reminds me of a story. My previous job, I had my coffee, typical morning, and then like I decided, you know what, I felt like I wanted a little more. So I made some fresh coffee and I drank some more coffee and I had double coffee, and then I was sitting at my desk and I was like, why is my heart racing? And I started like seeing things like differently, like my eyesight was like into the future or something. Like what is going, like time is moving differently, and I became real jittery and I was like, I want this to stop. I having gone through AFib, I'm like, I don't want to. So then I immediately just started pounding water, just started chugging water, and of course I just flushed it all out. And then after a few minutes, I was like, I calmed down. So maybe if you think you're having AFib, chug some water.
Yeah.
And if that doesn't
Flush your
help,
system out a little bit.
go to the doctor.
Yeah.
Okay. If your heart's still racing and you don't have any explanation for it, just go to the doctor. Just be safe, get checked out, make sure it's not something else.
So I feel like nowadays caffeine is in everything, and I mean I've been seeing like all these coffee brands doing like double shot espressos or triple shots, where like nowadays
Oh my God.
I've seen like I believe like the legal amount of like caffeine in a drink is like no more than like 300 milligrams of caffeine.
Yeah, like 302 or 320, something like that.
So I've seen brands that just kind of like tickle the line of like they go right to the 300 and that's it. But like that's still bad, and people are like, the kids these days are drinking those things.
So I have 1 cup of coffee a day, and I drink dark roast coffee. So here's what people don't understand about coffee. They think the lighter the coffee, the less caffeine.
Oh.
And that is the complete opposite, okay?
Yeah.
Green tea, yeah.
Green tea. Those light blonde roasts that everyone's so popular about have the highest caffeine content right now. So I like a really dark roast coffee with a little bit of splash of creamer, and I have 1 cup a day. I'm drinking that on my way to work after, you know, I'm dropping my kids off. I'm enjoying my coffee. That's my little pleasure of the day. And that's all I have. And now all my coworkers, like, you know, a lot of hospitals have a little coffee shop inside them, right? Because everybody loves coffee. And they're like, I'm going to head to the coffee shop. You want coffee? No, I'm fine. I had my 1 cup. I'm good. Are you sure? And then my boss will be like, I got to have another cup of coffee. It's like 4 o'clock in the afternoon. Dude, I'd be awake all night if I have that coffee.
Jeez. Yeah.
Turn into a gremlin. You can't have caffeine after 3 p.m. Otherwise, you're just like tossing in bed.
And my husband will come home at 5 p.m. with a giant coffee from McDonald's, and he's drinking it all night long. I'm like, dude,
I can't do that.
no. And then these like people these days are coming intolerant to this caffeine, and they're seeking more and more higher contents, more and more that oomph they need to get through the day.
That's why I had to wean myself off of coffee, because I was doing it so much so often that it just wasn't hitting me anymore.
Yeah.
So I mainly did it because the caffeine just wasn't doing it for me anymore. But I started to feel a lot better, that not having all that caffeine in my system.
Yeah.
So, you know. So AFib.
No, but I think the good segue in that is that, you know, obviously everyone's diet's different. Everyone's caffeine intake is different.
Yeah.
There's factors that people go through every day that don't realize could be contributing to something.
Yes.
And again, the underlying message has to be just be aware of yourself. If you notice something different within yourself, especially if it's your heart, or your heartbeat, your rhythm, something, take note, bring it up to a professional and mention, because obviously this isn't something that just goes away. It has.
And always remember to let them know you're drinking that Red Bull, because they will automatically exclude certain things. They'll look at things different. Diet and what you drink is extremely important, right? And medications, those herbal supplements you take, certain ones can cause heart arrhythmias that we've been finding out. I mean, you go to the vitamin aisle, how big is it at the store now?
Oh, it's huge.
And, you know, a lot of stuff is okay, but a lot of the newer stuff they're coming out with, like those green, what are they, like the gold with colon bloom or stuff like that.
I don't know. But I do know that nowadays I've been seeing a lot of people doing supplements for like just about everything.
Yeah.
And that's one thing. I mean, I think another big part is like, I hate to bash our culture or anything, but I mean, I'll be specific. My dad is diabetic, and he was walking through the flea market, and some guy was just hawking some juice, and he says, if you drink this juice, it'll cure your diabetes. So of course he starts taking it.
It makes it worth.
It makes his blood sugar spike. It makes it dip. And then the doctor was like, what are you taking? So it's just this juice. And it's like, yeah, stop.
That's the thing.
You don't know.
That is true. In this culture, that happens a lot.
Well, going back to the Hispanic culture, right? Yeah. We the superstitions, the brujas that they had, and they can cure everything. And you know, how many times the generation understanding that, and the culture that we have for that is also understanding, and making sure that you're not becoming gullible to that, I guess you could say. Seeking the education, understanding what's going on, and not just the guy at the flea market getting your juice.
Yeah, because we're always looking for that new fast way of getting healthy, that new drink that's coming out.
So let me tell you, it takes 21 days to develop a habit for anything, right? So if you stick something for 21 days, you're more likely to continue it. So understanding that and making sure that you don't fall victim to this, what are they call them, the snake oils?
Snake oils, yeah.
Yeah, so seeking the medical care, seeking a medical professional and getting their, you know, educated diagnosis that's what they're doing.
And I think, you know, obviously there's so many stigmas right now as to like who you're going to believe, who you're not going to believe or whatever. But at the end of the day, you got to consider like what's going to happen if I ignore it, or what are the side effects? I mean, obviously a stroke, and there's two things with a stroke. You can either live with having a stroke, or the stroke can take you, you know, and it's like both of those are extremes that you don't want to find out. It's like if you can prevent that.
People don't understand how devastating a stroke is, right? And it's usually they don't understand it until a few months later or something that went, or even after a few days, and how they can't take care of themselves anymore, and they have to depend on their family, and the family is working. They can't take care of their mom, dad, grandma, grandpa, aunt, uncle. And because let me tell you, my parents are older. Well, my dad has already passed away, but my mom is older. And my grandmother is still living. My mom takes care of my grandma. Right. And she's in her 90s, which I don't know what she did to get there, but she got there. But if something happens to my mom, I'm still fairly young, and I have to work to take care of my family. I can't take care of my mom. Who's going to take care of my mom? Right? My other siblings who live across the country?
Right.
Or is it me? And what do I have to do for that? So, I mean, understanding that stroke does not just affect you, it affects everyone around you.
Exactly.
And that's why education is so important. So the American Heart Association is a great resource, all heart related. They talk about AFib on their website. They talk about stroke. They talk about heart attacks. They talk about all things related to that. I even brought my little paper here.
Hey, there we go.
So the American Heart Association has wonderful education, and it's not only in English, they have Spanish too.
Perfect.
So for our culture here, the American Heart Association realized that the Hispanic culture has such a high prevalence for AFib, heart attack, stroke, diabetes, hypertension, all those fun good things that everybody has here. And they realized that, and they're like, well, we can't just do it in English, we have to do it in Spanish too. And the American Heart Association, I don't know if you guys know this, their headquarters is in San Antonio, Texas.
Really?
Yes. And you can go there and visit. It's super cool. I've never been there. I want to go. But San Antonio is high Hispanic culture too. They realize the prevalence of this. They've sent teams of doctors. So the University of Texas in Houston has a specific group that takes our information and they translate it to Spanish to be as closely possible to what the actual information is, right?
Mm-hmm.
So the dialogue is there. And one of the contributing sponsors for AFib is called, Getting to the Heart of Stroke, which they talk about AFib.
Mm-hmm.
HCA Healthcare Foundations, which is the owner of Valley Regional Medical Center and Rio Grande in McAllen.
Gotcha.
They're one of the number one contributors for this. They realize it's so prevalent, and they help with this education to send it out to the world because they know. And that's one thing about working for where I'm working now, is one reason why I switched over to them, was because they were so gung-ho about stroke, sepsis, heart attacks, which AFib is a contributing factor to this.
Gotcha. Yeah, it's very important to have that bilingual translation of that. I mean, us here working with media, we've noticed the importance of having the bilingual information out there, because our audience is very Hispanic based. The 956, the Valley, Spanish speaking most of the time. So it's good to have that out there. So to wrap things up here, education is key. Understanding your bodies, understanding what the signs and symptoms are, stroke, AFib, etc., is very important. Getting the education. Where can people find more information about AFib?
American Heart Association.
Mm-hmm.
You can Google American Heart Association, AFib, and it takes you right to their link. And you can scroll down, like, look, I have AFib symptom tracker, right?
Mm-hmm.
You can get that English and Spanish. They have Getting to the Heart of Stroke, Living with AFib, AFib medications, types of AFib medications that might be prescribed to you.
Mm-hmm.
Know your stroke risk, right? I have Should you expect long-term from AFib?
Goes on and on.
Shared decision-making for people living with AFib.
There you go.
And then facts and questions about AFib here. I pulled this from American Heart Association this morning before coming here. So, and all of this isn't available in Spanish.
Perfect.
So if you have family members and you're noticing these stuff going on with them, get them to a medical care professional. Let me tell you, 66% of the time, it's the people around them catching the signs and symptoms and getting the treatment for them. Right? 66% of the time. That's why education is so important, not just for our older community, but our millennials, our younger kids, because how many times are our kids with grandma and grandpa for the summer, right? Letting them know that, hey, something's going on with grandma, what's going on? And understanding exactly what's happening and seeking the care and then treating it. So we're, before it gets more devastating to them.
Right. Alrighty. Well, thank you so much, Michelle, for joining us.
Thank you. It was a pleasure being here.
Thank you so much for being here. And as always, everyone, make sure to stay safe, stay healthy, stay educated, and we will see you on the next one. Thank you so much.
Alrighty. I think that's about it.